So jumping right in. So I'm going to talk about results-based accountability and how do you use data effectively, and using a process called results-based accountability, which is a process that's used by many United Ways and by the United Way in Toledo and many others in Ohio. It's also used by the Ohio Health Department and many health departments in the state. So it's a way to help you move from talk to action, ends to means, data-driven decision-making, as we talk about it. And it's a framework, a process, and a culture. And the culture is really around a learning culture, how to use data strategically to make decisions. And our RBA was developed by Mark Friedman. Mark was the head of finance for the Health and Human Services Department for the state of Maryland. And he was frustrated because they didn't use data to make decisions. They didn't always move into action. They wrote a lot of very nice plans that never got implemented. And he was dealing with this. And this is where data can truly be helpful of understanding how we can change and improve, because we don't want to stay in our trap of being too busy doing things the old way and not being willing to learn to how to move forward. So he's written 2 books around RBA. The second one is Turning Curves, which is a story or a book of stories around how RBA is used all over the world. It is literally a worldwide phenomenon of helping organizations. I have clients in Kuwait, in Australia, in the UK, and in Canada that are using RBA. So in a nutshell, just to explain it very quickly, he makes a clear distinction between 2 kinds of accountabilities: population and performance, 3 kinds of performance measures to make it easy to use data, and then 5 core questions to turn the curve, which is how you use your data strategically to make decisions to improve. And turn the curve thinking, here are the 5 steps, and I'm going to go through those in detail in a little while. But the important thing is what we're doing is using data and turn the curve process to analyze your data to move from talk to action. And that's the key to this. And one of the quick story about this, I was doing a training in Wichita Falls, Texas, a number of years ago. And this woman at the end of the training said, wow, this is going to help our agency finally get the train out of the station. So I developed this slide for her, because what she said is, we have amazing staff meetings. We talk about all the things we could do, all the ways we could change and improve what we're doing. And they're great ideas. And we come back the next month and have exactly the same conversations again, but we never implement anything. So now she said, now we have a process to implement what we come up with. But I think one of the real game changer, if you will, of RBA and Mark's work is helping people understand data, because a lot of folks are not very good at looking at rows and rows, cells and cells of Excel data and coming up with a plan to do anything with it. So what he really highlighted is the power of RBA is through using trend line data, looking at the trends, because everyone can look at a trend like this. And this is actually the median hourly wage for everyone in Ohio based on the Policy Links Equity Atlas. So this is real data from Ohio from 2000 to 2017, and the median hourly wage actually was going down. And if somebody, I don't know whether that's on a mute or if people could put their phones on mute, but we're hearing some background noise there. So again, looking at this data, it's going down. What's even more important is we can disaggregate the data, because around democratization of data, we need to know the true story. Disaggregating the data by race, ethnicity, gender, age, what is ever the appropriate piece of this. So this is disaggregating the data based on race and ethnicity. You can see there is clearly some discrepancies because you can look and see the difference here between people of color and people that are white, people that are black, et cetera. And you could even further drill down and see the difference. So here is, if you're white, is the line on top, and if you're a person of color, the line below. So that gives us a very easy way to see the data, the true story, so we can develop strategies to try to minimize that discrepancy and move the hourly wage for people of color up, if you will. So that's just a quick example of how we can use data and trend line data so everyone can understand the true story. One of the other things that Mark really brought to the table is we have to have language discipline so we all understand what we're talking about, because organizations don't collaborate. People do within those organizations based on common purpose, relationships, and trust. So if we can't build that trust, we can't build the relationships we need. And if we don't understand the same language, if we can't speak the same language, we can't make that distinction. And in our world, we have all these words around data and improvement. And again, the key is that if people don't have a clear understanding of what a goal is, an objective, an indicator, or they put things like measurable, urgent, systemic indicators together, nobody will know what you're talking about. So the other thing that Mark brought to the table around RBA is a clear distinction between population and performance accountability. Population accountability is everyone in the geographic area, because your organization, your agency is trying to make sure everyone is healthy in the community, everyone is successful, not just the people that are lucky enough to be in your programs. So we want to make that clear distinction. So in RBA, there are only 6 concepts that you all have to agree to the terms and the definitions. Again, population accountability and performance accountability. And then under population accountability, 2 terms, a result and an indicator. A result is the condition of well-being for children, adults, families, or communities, because we're working to do ends to means decision-making. So we have to be very clear about what is that North Star, what we're trying to achieve. And so a result tells us that. So for example, all pregnant women experience a healthy pregnancy and delivery is an example of a result. And then the data that tells us how well we're doing in relation to that result is an indicator. We call population level data indicator data. There's a measure which helps quantify the achievement again. So maternal mortality rate. And then performance accountability is when we're doing our programs, our strategies, our actions. We're actually working on the ground with consumers, with customers, with clients, with patients, with students, whatever we call them. When we're doing work with people to help them improve, those are called programs. And so the Department of Public Health, a foundation, a nonprofit, a United Way are all examples of programs. And then the performance measures are the data that tells us how well we're doing in relation to that program. And there are 3 types that we need to track. How much did we do? How well did we do it? And is anyone better off? So once we have this clear agreement, and by the way, you can change any of these terms. You just have to be consistent. And in your field or in your area, say, this is what we're calling each of these concepts. So for example, in the UK, RBA is called OBA, outcome-based accountability. The Ohio Department of Health calls results outcomes. So as long as you're consistent and have that data dictionary, everyone can work together and understand what you're doing. So just a few more slides about results. Again, the population accountability, the well-being of whole populations, everyone in a community, a city, a county, a state, a neighborhood. You make those distinctions around the geographic area, residents with good jobs, children ready for school, a safe and clean neighborhood. And to help you do this, develop your results, there are 2 questions you can answer. What are the quality of life conditions we want for children, adults, and families who live in our community, however we define that community? And what would those conditions look like if we could see them? What would they look like? Kind of the mission and the vision is a way to think about that. So here are some examples from the California Department of Health. They developed these 5 result statements at their Center of Family Health to drive their work. And I think they're excellent examples of common language statements so that everyone in the community understands. They're not in jargon, they're not in acronyms, just very clear North Stars. Parents in California feel empowered and ready to parent. Pregnant women in California experience a healthy pregnancy and delivery, etc. You all can read those. But those are examples of result statements that everything that you do can align around one or more of those result statements. And then the data, the indicators, is the data that you use to see how you're doing in relation to those results. And that data is generated from community level data sources. So you don't just roll up your client program data because you want to know about everyone in the neighborhood or everyone in the community everyone in the state. So you have to look to the census, the State Department of Education, State Health Department, county health departments, or do random sample surveys to identify the data that you need, because it's not just program data. You need to find out the impact of what you're doing on the entire community. And so here again, back to California, all infants are born healthy, ready for a great start at life. They're tracking infant mortality rate, low birth weight rates, total preterm births per 1,000 live births, and breastfeeding initiation and continuation rates. So that's examples of indicators that tell us how well we're doing in relation to that result. But now, performance accountability. And this is where organizations truly use most of RBA and most of their time is looking to make sure that their programs, their activities are actually working. So here are the matrix that can help you understand how much did we do, how well we do it, and is anyone better off. So the upper left-hand quadrant is about effort and quantity. How much did we do? Number of customers served, number of activities, and which tells us how productive we are. And then upper right-hand quadrant, quality and effort. How well did we do it? And that tells us, are we doing things right? Customer satisfaction, following our protocols. And the most important is the retention rates. Did people stay in the program long enough to get the benefit of the program? Doesn't matter how good your program is if people don't show up. Again, we can have our vaccines. If they don't take them, it doesn't matter how effective the vaccines are. So how do we know that what we're doing things right? But the most important measures is anyone better off? Are we doing the right things? Because this is directly tied to the goal, the purpose of the program, so that we know whether our program, our strategy is working. Because everything we do is designed to change skill, knowledge, attitude, opinion, behavior, circumstance, or condition. And those are all measurable through observations, evaluations, pre and post tests, whatever that is, so we can find out, are we changing skill, knowledge, attitude, or behavior, circumstances, or conditions. So here's an example for after school programming. And when I was with the United Way in Tucson, Arizona, we brought all the agencies, the 6 agencies that were doing after school programming together collectively to identify the performance measures they agreed to collect individually and share collectively. So we could see how the initiative was working, the strategy was working overall, and they could learn from each other. So they came up with number of students, how well do we do it, percent of students attending 3 or more days a week, and then the number and percent of students learning 3 or more new skills each quarter, because they decided they wanted to not just babysit, but teach new skills. So they tracked whether kids were learning the new skills each quarter. They developed a pre and post test, and they could learn from each other when they met each quarter to see how the data was progressing, and what they could say, wow, you're having better luck teaching that computer skill than we did. How did you do it? So they can make those mid-course corrections, because typically performance measure data is collected quarterly, so you can make those mid-course corrections during the year and not wait till it's too late after the year to make any changes. So turn the curve thinking, how do we now use that data? Going through these 5 questions, and we use it with population level indicators. It's to identify new strategies or activities or public policies to implement. When we do it with performance measures, it's to identify action steps that staff, partners, volunteers can take to improve your program real time in what you're doing. And again, as I highlighted, it starts with just using the trend line to see how we're doing, because baselines or trend lines have 2 parts, the history and the forecast. So if this is the high school dropout rate, and the history is it's going up, we can assume if we do nothing, it'll continue to increase. So we ask a simple question, is that trend okay? Yes or no? And if it's not okay, we want to turn the curve. So that's why we call it turning the curve. Because if it's going up, that's bad, we want to turn it down. If it's going down and that's bad, we want to turn it up. If going up is good, we want to accelerate it. So it's always around turning the curve. And to do that, first we need to understand what are the factors pushing up and pushing down on that trend. So again, it's very easy. Again, you can do this either on a piece of paper with this, or we actually have software that supports this. So you can look at the trend line and go through these notes. The first one, story behind the curve, what's pushing up, what's pushing down on the trend. so that you have factors, issues to work on. And then you will always want to ask, are there any factors causing disparities around equity? So this is the third grade reading level from Tarrant County in Texas. If they look at this, again, if we look at all children, it's in the 40s and flat, we need to deal with that. But if they disaggregate the data, they see a very different story. And again, it's not to blame or target the Black and Hispanic kids. It's around what are the factors that are impacting them that we can work on so that every child has a chance to improve their reading levels as we do this. Once you brainstorm all those factors and look at these issues, and you can read this later when you look at the PowerPoint, but all the factors, and again, looking at institutional racism, unfair policies, all of those things, so we truly understand the true story. The next question then, once we've identified and prioritized the factors we want to work on, is who are our partners that have a role to play? Because no agency can do it alone. How could we reach out to some partners to help us do the work? And we want to be as specific as possible, not just list the business community, the education community, the faith community, but what church, what business, what school can we call, or what agencies can we call or connect with to help us do this? I was just doing a turn the curve exercise yesterday with a group, an agency, and this one staff person was really frustrated. He said, I've got to do all this. I'm doing all of this. So because he was so focused on what he was doing, I said, but again, that's why we have this discussion, is to broaden your solution space, get you thinking outside the square so you can think of new partners. Like they were talking about, I can't do all these things. Well, maybe there's a church you could engage, or an agency or something else to do that. All of a sudden, he began to see that, wow, I don't have to do this all myself. There's ways we can build partnerships. And those partnerships need to include the individuals we serve. So the people we serve should be viewed as co-producers of their own and their community's well-being, as well as their neighbors, families, friends. How do we engage everyone in this work? Once we identify the partners, then brainstorming, what are all the things we could do to make a difference, to turn the curve? Evidence-based practices, promising practices, multifaceted approaches, public policies. But because it's brainstorming, you also want to include off-the-wall ideas, because sometimes an off-the-wall idea will lead to something. And again, you also want to do something we call low-cost, no-cost ideas. What can we do without a grant? What can we do without new money? Just acting differently. This is also where you can have a rich role and discussion around the role of parents, students, the people we serve, and see how we can engage them. So if we're trying to get to population level accountability, and we're doing a training program to teach moms how to breastfeed, for example, one of the pieces we talk about in the class is, now that you've learned how to do this, go back to your neighborhood. And if there are some moms in your neighborhood that are pregnant, that are soon going to have a baby, talk to them about what you learned to help them breastfeed, so we can spread that knowledge. So again, and then we end with an action plan. When you do it with indicators, to develop strategies. When you do it with performance measures, to develop the action steps. And we always want to be specific: who, what, by when. So strategies, organizations, action commitments, action, who's going to be responsible by when to get it done. So that's turn the curve thinking. And how this all fits together is you have your results and your indicator data. You do turn the curve thinking to identify your programs or strategies you want to implement. That's population accountability. Then you take all of your strategies, your programs that you're going to implement, you develop your performance measures about how much we're going to do, how well we're going to do it, and is anyone better off? Again, this is a very simple framework. And then you apply turn the curve thinking to those performance measures that are not achieving your targets. So in a performance measure, you want to look at the data, also set a target. So we want 80% of the participants to attend 80% of the sessions. Then if you're not achieving that target, you can do turn the curve thinking to come up with action steps to improve what you're doing. And that's performance accountability. So just to give you a quick example, in our scorecard, in our web-based system, that you can use to do this. This was a turn the curve exercise that we did with Promise Neighborhoods grantees, because at Promise Neighborhoods, which is a program by the Department of Education, they use the scorecard, they use RBA to drive their work. And one of their results is that kids succeed their overall goal is succeeding from cradle to career. One of the key indicators they track is our kids getting into universities and graduating from universities. So they were tracking here the trend line around that, those goals around those enrolling, graduating, receiving certificates, and also tracking through a random sample survey in the neighborhoods the number of parents that are talking to their kids about the importance of college and career. All of those trend lines are not where they need to go, kind of trending down, not trending up. So they brainstormed the factors. Again, looking at the data here, they then brainstormed. Again, we did this remotely on a meeting, just like we're doing now, and they brainstormed those limiting negative factors pushing down on the trend, those factors pushing up on the trend, the factors creating disparities, so that they had things they could now work on, issues they could address. And then they talked about the partners who could help us address these factors. And again, because it was across the community, they identified just broad sectors that locally they can drill down on. And then they came up with what works. Master prep curriculum boot camps, grants to support it, promising practices, no cost, low cost community engagements, mentors from the community in the neighborhood, find people that have been successful moving from high school to college to careers, have them mentor other kids in the community, do more job shadowing opportunities, public policy change, modify the Pell process to make it more user-friendly. Because one of the things they identified, it's really hard to navigate that transition. Transforming system solutions, scholarship awareness, not the role of guidance counselors alone. More focus on soft skills, off the wall ideas, expand remote internships, and free college for all. Again, that sounds kind of an off the wall idea, but there are ways to begin to do that. And some of that is being discussed. And then they came up with their strategies, community-based mentors, college and career counselors at each school, and career connection. Asked the Chamber of Commerce to get involved more. So I'm going to wrap up now talking a little more about the democratization of data, the importance of sharing data with the people we serve. In the nonprofit sector, particularly, we have to make sure that we view the people we serve as not just recipients of service, but as co-producers of their own and their community's well-being. So to do that, we have to share the data with them. And that's, again, one of the advantages of our RBA. Everyone can understand trend lines, so you don't have to be an expert at Excel. You can just look at that trend line in the neighborhood, in the community, look at some trend lines and ask people to respond with the true story around that. So share the data with the community we serve to create greater engagement and trust. Because again, one of the things I highlighted, we've got to build that commitment to common purpose, relationships, and trust to work together. So we must view the people we serve as co-producers of their own and their community's well-being. And we must understand the true story of the data. So we have to solicit the input of the people we serve about their lived experiences, have to disaggregate the data, and then engage them so we understand the true lived experience, those factors that we need to work on to help move from talk to action and improve what we're doing. And finally, I want to highlight, I think it's really important that we engage the people we serve in the decision-making process as well, because people impacted by a decision should be involved in making the decision. We often talk about this as nothing about us without us. That's another way to think about it, because one of the dilemmas in nonprofit world and agencies and organizations, we often make decisions we don't have to live by the impact of those decisions. Just the people we serve do. And that's kind of not fair if we're going to build effective trust in relationships. So people need to be involved in those decisions, like when an agency's open, where it's located, what services are offered. Get the people we serve involved in doing that. And part of the ways of doing that is to democratize the data and share it with them so we're all working together. So now we're going to, I think, open up